As a human, I do a lot of thinking about time, right? And as a doctor, I think a lot about time too, because really that's how I get paid, right? As a doctor, I sell my time. That's all I do. But as a PCP, I've really been forced to sell my time within the confines of 10-minute office visits or 10-minute video visits. So I could sell it another way, right? I could send a text to somebody, right? I could say, hey, Val, just checking in. How are you feeling? Thank you. All back to normal. Great. But I could also send that text, and all of a sudden, it's not good. This lump is still there. I'm really scared. What do I do, right? As a doctor, you hear that, and you're like, oh, my goodness, time. And that's all you think about, you know? It's like, how can I effectively treat this person with the time that I have? So I've only got so much time as a doctor. But something's changed in the last 30 years, and I don't really have to explain it to this crowd, but like we don't use these things anymore. We kind of wish I used Swatch phones still, but we don't. And then we don't do a lot of meetings, like you saw in Mad Men. We do things like email, right? We got email like 30 years ago, right? We got, AOL instant messaging like 20 years ago. It really did sort of change how we communicate. So the iPhone came along about 11 years ago, and it changed everything, obviously. Now we have things like Slack, we have things like Google Docs, we have Dropbox, we have WhatsApp, we got Instagram, we got Facebook Messenger. All of these things change how we spend our time as human beings. So what's crazy about this is everything was like coming along just fine. We were sort of cool with email, cool with IM for a while. And the iPhone hit, and all of a sudden, now we have 100,000 new ways to communicate and solve problems. But there's this other problem that you see on that little hand-drawn blue chart. The ways I can bill my time doesn't change. And that's a problem as a doctor. So the healthcare industry has said, you know what? We're going to bring video visits to the world. And, there are lots of companies doing this, and that's great. They exist for 3 reasons. Number 1, billing reasons. A 10-minute video visit is about the same as a 10-minute office visit. Not much of a stretch. Healthcare, we're not really, super into innovation here. So it's kind of cool to just deal with that, billing issue. The docs that designed this in the beginning, they assumed that they needed to visualize the patient, right? And that was an assumption based on just sort of ignorance. They didn't know. And healthcare has this long history of designing around doctors' whims and, the fee-for-service business model, rather than what patients really want. So let's put telehealth in perspective. Where does it stand today? There are about 3 million doctor office visits per day in America. There are about 300,000 urgent care visits in America. And the leader of the telehealth industry has said that they do about 3,000 video and phone visits per day, right? So kind of not really taken off. So the CEO of Kaiser Permanente about 2 years ago went on record saying, hey, per year, over half of our patient interactions are all virtual. So there have been about 20 million email collaborations, 17 million online prescription refills, 4 million scheduled appointments done online, 37 million tests viewed online. That is what's called asynchronous conversation. It's problem solving. It's just, making appointments, right? It's nothing special. But from 2015 to 2017, Kaiser, in a study that was just published about 3 weeks ago, they looked at how many video visits they did over the course of those 3 years. They did 210,000 total video visits were scheduled, only 60% were completed. About 152,000 patients chose that route of communication. That means about 1.25% of their 12.2 million people actually wanted to do a video visit in an environment where this doesn't really cost the patient hardly anything, if anything at all. So what I'm saying is not many people are choosing this methodology. And that makes sense because we don't communicate via video with strangers as a natural human behavior. So you look at the stats and the rise in the video visits in Kaiser Permanente, and you see in the beginning, everybody got excited, went from 0 to, $25,000 a quarter in about 2 years, but then what happened? Now it's looking like it's kind of flattening off, right? So nobody really asks, how can we as doctors and patients communicate and problem solve with today's ubiquitous tools, the tools that we use all day, every day, email, text messaging, everything. Now, the second question that you got to ask is, how can we pay doctors differently for their time? Because if you could build a healthcare, what would healthcare look like if we actually built care services around these cultural changes and brought them to the doctor-patient relationship? Well, first of all, you got to give a person one simple online place to get care. It's that easy. And remember Google? All right. So they did this thing, and then you don't have to go to this library place, right? Of course, Uber, we've all seen this slide, I think 32 times today and yesterday. But you don't have to call this guy anymore to get a taxi. And you don't have to go out there and flag one down anymore. It's just so dead stupid simple. So patients need one simple place to go online to get care. Because right now what they're doing, they're calling this lady, they are waiting in the exam room, then they are going in and talking to the doctor and having a conversation like this, and then they're paying that doctor $100 or so for that 10 minutes, right? That is what happens in healthcare 3 million times a day. So the second thing you got to do for patients is build a robust online service on par with the capability of urgent care and office-based PCPs. You can't build a service like video visits that solve really only 30 simple things. You got to build a service that actually provides roughly 1,500 diagnoses, management of about 1,500 diagnoses, because that's what people need. Those are everyday primary care needs. So how do you do that? You could do that with just text messaging, right? But that's going to be extremely inefficient, and it's going to fall apart quickly. So what you got to do is you got to create just that one simple place again, reach out to your doctor via a browser and an app, and create an episode of care. So what does that look like? Notice it's really easy. It's a free text box. Write a paragraph, maybe 2, really dive deep into what's going on with you, add a picture, send it off. Your doctor, and you always work with the same doctor, because continuity is important, reads the story, looks at the photos, and responds with a broad set of questions. So you're hanging out, looking at poison ivy on the Mayo Clinic, you get a new message from your doctor, you jump in, and there's a bunch of questions for you, right? Notice it's free text, because the best way to get the best information from people is to just let them talk, right? Let them put things in their own words. Don't send them questionnaires. Let them just answer questions. So notice there's about 27 questions. Your doctor is diving in deep, right? So you respond, you hit send, and your doctor might want you to get some labs. So here's some instructions for how to get tests. If you need to get imaging, your doctor is going to get you some imaging. They're going to order the test, and then that result is going to pop right back into that episode of care. So everything is right there for you and right there for your doctor. If you need to take a medication, all you do, your phone knows where you are, you type in your zip code maybe, you find your pharmacy, it's dead stupid simple, you fire off a prescription to your medication, everything's great. If you need to go see a specialist, it's very easy. All you have to do is look at who you're supposed to see. After you go see this specialist, the specialist sends that consult report back into the system, and you get access to that. Notice it's digital fax. I hear interoperability is a challenge in healthcare. So the digital fax is actually pretty wonderful. It connects us all. Huge fan. So that being said, you should definitely be able to, as a patient, just log in and read exactly what your doctor has diagnosed you with, right? Make it dead stupid simple for people, because the evidence is people forget 85% of what their doctor says in an exam room, right? That means I'm 15% effective at my job, and that's pretty sad. So you do need to give people a really easy way to just log back in and read the entire conversation with the doctor. So imagine a doctor that's not paid for an office visit, but they're paid to just check in, right? You should be feeling better right now. Hi, Jane. How are you doing? What's going on? Give me an update, right? That's empathy. It's just empathy, right? Now, there's something that we've witnessed where we're all sort of getting along in our years, and we've known what it's like before the internet and sort of after the internet, right? I basically say that the ubiquitous asynchronous digital communication is just as important as the printing press. We're going to look back on this 100 years from now and say, you know what, whenever we were able to communicate via email and text messaging and Facebook Messenger, that fundamentally changed how we as humans connect. So I'm going to talk a little bit about synchronous communication and asynchronous communication. Synchronous communication is things like exam room conversations. There's 1.1 billion of those per year. Phone calls, whenever you're talking to somebody in real time. How about those doctor-patient video chats? Not a ton of those per day. But the asynchronous conversations, email, shoot me a text, WhatsApp, Facebook Messenger, those are tens of billions a day. It is just far and above how humans are communicating. So, asynchronous conversations, though, the email, that kind of stuff, it unlocks a whole new world of opportunity. In synchronous conversations, the processes are linear, and linear processes are prone to bottlenecks. That's because, doctors, if you're sitting in a waiting room and you see a patient, and they're complex. If you're a doctor and you're seeing a patient that's complex, you got to spend more time with them. That means all the patients the rest of the day are waiting on you. But with asynchronous conversations, the processes are branched and hyper-efficient. It's more like triaging your inbox. So oral conversations need to be documented. Doctors spend about 40% of their day documenting just that oral conversation. With asynchronous communication, the communication is the documentation. So with synchronous communication, it's almost impossible to standardize. It's a doctor basically asking questions in their own way and in their own words. With asynchronous conversation, you can standardize how doctors ask questions about your abdominal pain, for example. With synchronous conversation, this is a tiny snapshot. That 10-minute office visit for your 3-week ordeal is a 10-minute tiny snapshot of your situation. With asynchronous conversation, I can check in with you throughout those 3 weeks, and I don't have to make you come in. It's such a light but high-touch care. So with synchronous conversations, every conversation is deemed important. It's sort of like if you show up at a new job and they're like, we don't believe in email here. Everything has to be done via a meeting. That's kind of healthcare, right? So with asynchronous conversation, though, most healthcare communication just doesn't require the intensity of an in-person meeting. So when time is limited, when you're a doctor and you got 10 minutes with a patient, there's really no chance to read up on something that you haven't seen in a while. And you also can't ask a colleague for their opinion. So with asynchronous communication, you can say, I haven't seen this in a while. I'm going to read up on this and then respond to you in the most knowledgeable way, right? So with synchronous, you've only got 10 minutes in this visit. I don't know when I'm ever going to see this person again. I'm going to bring out the big guns because I don't know if I'll see them again, right? With asynchronous conversations, you can say, hey, I don't know exactly what's going on right now, but I have a hunch this is what it is. Let's reconnect in the morning, and then we'll take it from there. So I can practice way more conservatively. So in those office visit synchronous conversations, you got a patient, you got an EMR, you're funneling with exam room tools, all that stuff. It's very complicated. With asynchronous, you're just triaging messages, you're responding to messages. It's like hyper-efficient inbox zero kind of work. So doctors are extremely efficient whenever they're practicing asynchronous messages. So you got to create a new billing mechanism, though, because all of this is great, but if there's no way to bill for it, you're screwed. And what I like to say is the new billing mechanism is an episode of care, right? So think of it more like an email thread that lasts for as long as it takes for you to get better. Over days, weeks, months, what have you, your doctor and you are communicating within this email thread. So a typical episode of care is 3 days for a UTI, 3 weeks for a pneumonia, 3 months for a new breast lump. And 95% of these things are just messaging and photos. Only about 5% of the time do we jump on a phone call. That just basically means that messages and photos and phone is really all you need, right? So the big summary here is 95% of all primary and urgent care issues, about 1,500 diagnoses, can be diagnosed and treated by virtual PCPs without in-person visits. That's a scary statistic, right? So how do you get there? I'm sure everybody's like, I don't believe you, But really, 95%? That's because of the way doctors diagnose people. They ask you questions, they examine you, they order tests, they collect data like blood pressure and things like that. They experiment saying, I don't know what this is, but I'll treat you with this drug, and if it works, that's what you had. And the other thing is they just watch and wait to see how things evolve, and that then offers the diagnosis. So can these be done online? Asking you questions, yes, and even better to ask you questions online than in rapid-fire conversations in an office visit. Can they examine you? They can't do that old-fashioned exam, but they can ask for photos and things like that. Can they order tests? Yes. Can they collect blood pressure and temperature? Increasingly, yes. Can we experiment? Yes. Can we watch and wait? Yes, and it's better to do it in an episode of care. So what can't be done online? We can't do procedures, obviously. We can't do sutures and stuff like that, but we can do some physical exams online. You know, we can't do stuff like this, right? But at the same time, that's just quaint, you know? It's theater, you know? If a doctor is suspecting an issue with your, reflexes, they're not going to diagnose you with this thing. They're going to jump into something a little better. But there are also tests that we can't do that are actually really good. So whenever you're diagnosing an otitis media, an ear infection, you just look in there and it's kind of obvious. So let's analyze the top 1,500 conditions that can be managed by a PCP. Let's look at an ear infection. How do you do it? You ask a bunch of questions. That's how you do it. You look in their ears, done. That's pretty much it. But what about a migraine, right? We're going to ask you a bunch of questions. There's no exam findings for a migraine, so I don't really need to see you in person. I could just basically manage you and communicate with you over time and make sure that whatever I'm doing for your migraines, is helpful for you. So for those issues that have a high reliance on a physical exam, is there a proxy? Well, acne, skin infections, rashes, and things like that, I need a photo. Photos are actually really good. You can compare beginning and end. Broken leg, can you jump up and down? Well, if you can jump up and down, your leg's not broken. What about pneumonia? Well, there's this thing called a Res app, right? It's basically Shazam for coughs. So you can cough into Res, and it will spit out, here's your chances of having pneumonia. So managing these chronic issues is getting easier and easier. I can do, manage arrhythmias. I can manage diabetes with OneDrop. I can manage asthma with Propeller. And I can even order tests sent to your office or to your home via Everlywell. So LabCorp is also getting into this as of last week, but that's how we get to the 95%. Not a lot of stuff needs an exam. So that being said, a lot of people are like, hold on, Marcus Welby, you can't kill him yet, but he's dead, unfortunately. He's no longer with us. At the same time, you still can have that online meeting, online relationship with somebody. Whoops. So anyway, quick question. If you spent 10 minutes with somebody professionally 2 or 3 times a year and you didn't have their email or phone number and you had to schedule a visit with them via their assistant, is that a meaningful relationship? 90% of people say no, right? So that being said, what if 80% of the time you show up and you meet one of their assistants? That's happening all the time, nurse practitioners, physician assistants. People don't really have that old-fashioned relationship much anymore. But new flavors of relationships are unlocked by new ways to communicate and share. Have you ever befriended somebody on Facebook or Twitter or Instagram or something like that, and 2 years later you're like, wow, I have never met them, but I feel like I know them? Sort of like that, right? So the traditional doctor has always been associated with the neighborhood. So if you move, if you're traveling, if you change insurance, it's all over. So asynchronous primary care is a tool. But there's no such thing as a single tool to solve every single problem. You're not going to use a Leatherman to carve that guy. So let's look at what people need. About 40% of us spend less than $200 a year. About 30% of us spend about $200 to $1,000. 20% spend about $1,000 to $5,000 a year. But that's that power user. It's about 10% of us, they spend $5,000 plus. What I'm saying is 95% of those problems for 80 to 90% of America could be exclusively solved via episodes of care without in-person visits. So my team of doctors have been doing this for 7 years, right? And I spoke at the School of Visual Arts a couple of weeks ago, and the chair of the department asked me, why haven't you quit? 7 years, you should be a multi-billion-dollar company. It sounds like a good idea. But this guy really inspires me. He's Eugene Debs. He's the first guy to ever run for president from a jail cell and get over 5% of the vote. He said, when great changes occur in history and great principles are involved, as a rule, the majority are wrong. So you look at how innovations happen in healthcare. For example, anesthesia. When anesthesia was first being promoted, the surgeons were anti-anesthesia, right? Because they said they listened to the screams and wails of their patients to guide their surgeries. So it took more than 50 years, really, to reduce smoking in this country. Progress in public health just takes a long time. So we persevere, and we wait until the time is right, so that something becomes politically feasible. It's a matter of waiting until the time is right. So let's not forget the fundamentals. Healthcare, the doctor-patient relationship, at its core is just two people talking in a room, right? They can talk online. So we've seen over the last 20 years that the companies that make communication easier between humans, they win, and they change what it means to be a human. So I used to get frustrated that healthcare moves at such glacial speed, but then I realized we're 20 to 30 years behind other industries. We got a playbook. We know how the industry is going to play out. So we can just sort of take advantage of that and build things. So you got to keep your head down. You got to focus on the fundamentals. You got to communicate your vision, and you got to show people there is a better way, because you got to stay alive as a business just long enough to be there, perfectly positioned for the right timing. So thank you very much.
Real quick question. What are the implications for training physicians for this world?
You know, it's fascinating because when was Amazon founded? Like 1993? The med students of today are sort of, younger than Amazon, right? So they grew up in this world, so it's just going to be natural for them. You just got to give them that technology, and you got to give them the billing mechanism for that to work.
Great.
Yeah.
Thank you, Jay. Thanks.